Okay, well, good morning, everyone. Thank you for joining today. Appreciate you making time. This is a situation where we felt it was best to bring back our calls. As many of you know, during the height of the pandemic, we held daily update calls for our stakeholders to keep you in the loop on what was happening at the local, state, and federal levels, resources that were available, information that was available to help you get through the height of the pandemic. Things got a little bit better. As we know, things started to reopen. We scaled back to a weekly call, and then we put it on hiatus back in September when things really started to rebound. Unfortunately, as we know, the numbers are going up again. The cases, the hospitalizations are going up. There have been some closures, some things put on pause for a few weeks. So we felt it was time to bring the call back because we know that many of you are facing very uncertain times right now. And we want to, as we did before, provide you the latest information to help you make decisions for your organization. So for the time being, this will be back on a weekly time, same time we've done it as always, Tuesday at 9 a.m. So please continue to pencil this date and time in your calendar. We are very fortunate to have two guest speakers here today that I think are going to provide some really relevant, very timely information. And what I'd like to do is introduce both of them, have them both talk, and then we will open it up for questions from the listeners. And then I have a number of other programs and updates I want to give you some information on, but I'll do that after our speakers are done. So that'll be the agenda today. Once again, thank you all for making time to be here and listen in. So what I'd like to start with is a new individual. We're very blessed, very lucky to have a new liaison with the governor's office. This gentleman's name is Gary Jones. I've got a chance to talk to Gary a few times. He's a great guy, really wants to get engaged in Shiawassee County. We had him introduce himself to the SEDP board last week and thought it'd be a great way today to get him more engaged with Shiawassee County stakeholders by coming on this call and giving you an update and making himself known to our local folks as a resource for all of you. So I'd like to start with Gary so he can introduce himself and let you all know what he's available to help you with here in Shiawassee County. So Gary, I'm going to turn the floor over to you.
All right. Thank you, Justin, and good morning, everyone. And hopefully at some point in 2021, maybe we can do this all over, some kind of table or something, preferably with food around. But at the moment, what I would like to do, normally when I give, my update presentation, I usually just start out, with our numbers as far as like what COVID is looking like statewide, and then just try to provide like sort of a like highlight points, that we are noticing from the past week. And then, like Justin mentioned before, allow for any questions, on the material or otherwise, if there's something else maybe I did not cover that you might be curious about. And if I do not know the answer, I am the master of doing research and, trying to find an answer. So let me begin first by saying, beginning with our total confirmed cases number as of today, we are currently at 314,216 confirmed COVID-19 cases statewide. Total COVID-19 related deaths are now at 8,543, so we passed the 8,000 mark, unfortunately. And total of recovered COVID-19 cases as of November 20th is 152,267. And as a note, recovered is defined as the number of persons with a confirmed COVID-19 diagnosis who are alive 30 days post-onset. And I usually like to give that recovered number just as a, because we always talk about the confirmed cases, and I used to try to give some idea, that there are people, who are coming through it. Even though coming through COVID-19 does not necessarily mean people are at the same level of health that they were pre-COVID-19. There are still some complications that people are experiencing due to actually having contracted virus. But this number just gives sort of a snapshot that people are recovering. And it's, for some people, like a number that symbolizes that there is some hope, that's out there. So MDHHS, I'm sure everyone, is familiar with this, issued recently a 3-week epidemic order in order to save lives and also protect our frontline heroes during the fall COVID-19 surge. There were new outdoor limits in indoor and outdoor gatherings where COVID-19 is more likely to spread from person to person. The Michigan Department of Health and Human Services issued this emergency order. This was actually last week, so we're inside of this period now, but it began last Wednesday. That enacted a 3-week pause that Justin referred to earlier, in targeting indoor social gatherings and outdoor group activities, all in an effort to curb the rapidly rising COVID-19 infection rates throughout the state. Also recently, Governor Whitmer, as well as Democratic leaders, sent a letter to the president, as well as Congress, urging them to pass a bipartisan COVID-19 relief bill. So the governor, our Senate Democratic leader, Jim Maninick, and House Democratic leader, Kristen Gregg, sent a letter to the president, Senator Mitch McConnell, Speaker Pelosi, Senator Chuck Schumer, and Senator McCarthy, urging them to take swift action and pass a COVID relief bill that provides support to help combat COVID-19, mitigate its economic fallout, provide support for our schools, and protect frontline workers, restaurants, and small businesses. And also, bipartisan governors from Michigan, Illinois, Indiana, Kentucky, Minnesota, Ohio, and Wisconsin recently urged safety before the holiday season. So Governor Whitmer, Illinois Governor Pritzker, Indiana Governor Holcomb, Kentucky Governor Beshear, and Minnesota Governor Walz, as well as Ohio Governor DeWine and Wisconsin Governor Evers, joined together in a social media video to encourage everyone across the region to remain safe heading into the holiday season. Over the past month, COVID-19 cases have skyrocketed across the Midwest, and medical experts are advising people not to host Thanksgiving with people from outside of their households. Together, the governors each addressed the families in their region on how they can protect their loved ones, frontline workers, and small business owners from the COVID-19 pandemic. And as always, at the end of every presentation I just always remind people that every update that we usually publish and post, we put it on michigan.gov/coronavirus. So that is the best website to keep updated with everything.
Great. Thanks, Gary. And I do have a question for you, but as I said, I want to give our county health department director, Larry Johnson, a chance to give an update too, and then we'll open the floor to questions for both of you, if that works okay. So Larry, I'm going to ask you to jump on right now.
Can you hear me?
Yeah, you're good.
Oops, I thought we did. Can you hear me now, Just?
Yeah, you're good, Larry. Go ahead.
Okay, sorry about that. Thank you, everyone, for having me today. Really appreciate it. Seems like it was.
We'll find out why she's not there yet, and then if we have.
Can you hear me?
To cover it. Yeah, unfortunately, just make sure that she's listening.
Yeah,
Yep.
we need to. We're gonna put folks on mute. Sorry.
Yep. And then
Yeah,
Okay, I'll wait.
supervisor will be over me.
Let me try muting
thank you.
again.
Yep. Okay, there we go. Hit *6, Larry, and then you'll be back on.
Okay.
Oh, you there?
Okay, can you hear me now?
You're good. Sorry, everybody. We had to mute the background noise, so apologize for that, but we're good now. Go ahead, Larry.
Oh, thanks a lot, Joseph. I'll just get started here. I don't want to take your valuable time for all of you. Just give you a local situational update. Really appreciated hearing from the governor's liaison, Mr. Jones. So locally, as of yesterday, when I ran the numbers for the schools, we had 1,647 cases, confirmed cases. That's on a 10-week upward trend. We week over week, we've been seeing the highest number of weekly cases, basically since the beginning of the outbreak. Some of the metrics that we measure, one is the positivity rate. We are at 13.2% as of this morning, and that has steadily been increasing over the last 6 weeks. We look at hospitalizations. We have had, yesterday we had 18 hospitalized at Memorial, including 4 in the ICU. They are at 42% occupancy with a 7 to 14 day supply of PPE. Healthcare capacity is stable locally, but Memorial is watching very closely because they've been bouncing around between 13 and 18 COVID-19 patients in the hospital over the last few weeks. Unfortunately, we have had 4 deaths in the last 2 weeks, and that were COVID-19. Our cases per day per million is another metric we look at, and that's extremely high right now. It's at 407 new cases per day per million. Our tracing and containment infrastructure is not in a good spot right now. We're unable to keep up locally at the health department with the large number of increasing cases. So we're doing priority case management, focusing on those under 20 and over 65, and cases related to schools, healthcare, and long-term care facilities. Testing demand at Memorial has increased significantly in the recent weeks, trending the nationwide trend, and they have been unable to guarantee results within 72 hours, and it is now by testing by appointment only. So, we're not seeing a good situation right now, which is kind of why we're all here. We've got the 3-week pause that Mr. Jones referred to, not a complete shutdown, but it is a 3-week pause. It started affecting the schools and the bars and restaurants and some of those facilities where there's congregation. The majority of Shiawassee schools have gone all virtual for varying lengths of time. I know Owasso, that's one that I work closely with. They've just shut down till January 11th. That's 1 week after New Year's. So I'm working really closely with the superintendents. I speak to them every day. They've got a real challenge, and that is a really tough situation, especially for those young ones that are K through 8. With regard to, what some questions you might have, I shared a couple documents with Justin via email that he's going to share out with you. One is MIOSHA's guidelines and requirements. The big thing in there, it has some industry-specific things, but one of them is the work from home. If you are able to work from home and do your job from home, MIOSHA basically the state wants you working from home. Now, that's not practical for a lot of people, but for some it is, especially like professional office settings or something where you can work remotely. Michigan Department of Agriculture and Rural Development is taking some enforcement actions on their facilities. They license grocery stores, gas stations. I wasn't sure how much they were going to be able to do, but then I saw a copy of an enforcement letter that went to one of our local businesses, and I was like, oh, okay, they are doing some stuff. Michigan Department of Health and Human Services has a violation referral email for law enforcement. So for law enforcement that is taking any enforcement action, there is a referral process to the state. They basically have to, cite what was happening, and then they can refer it to the state. And whether or not the state can follow up, I can't tell you. I mean, it's so big, it's so complicated, and there are such limited resources. But I'm just giving you the information that it is out there. Couple other things. Most of the cases that we've seen, quite honestly, have been traced to congregating of people. So you're talking weddings, funerals, family gatherings, indoor congregating, some connections to bars and restaurants, but not a huge number. I mean, you're seeing more employees that get it and then have to go out, and then you have to quarantine staff. So, the vast majority is just those where you're getting lots of people together and you're not sitting 6 feet apart and you're not wearing your mask. And so, we've had a challenge with that. I wanted to touch on the indoor capacity, outdoor capacity gatherings. I think Mr. Jones might have mentioned it, but indoor gatherings are prohibited to just 2 households or less with 10 or less people. Outdoor gatherings, 25 or fewer people, no more than 3 households. Obviously, the virus transmits airborne, and in outdoors versus indoors is better because the air flow can move the virus. So I just wanted to give you that. That is in the guidelines that I've shared out. So you can reference that if you want to look at it. So I just want to kind of touch on some positive news because I think we all need positive news. Within the next 30 days, a vaccine shipments are going to start coming from the federal government, and they're going to go to they're going to start with large hospital systems. And the focus right away in the beginning is going to be on frontline healthcare workers. They are going to be the first to get the vaccine, and then they're going to set up the priority groups. They haven't established it yet, but it's expected to be the elderly, nursing homes, EMS, frontline workers. Some news on that vaccine: both Pfizer and Moderna have put out data on the efficacy of their vaccines, and they're astounding results. They're 95% effective. Now, these vaccines have been developed by the smartest minds in the world, and they will not be released to the public until they're deemed safe, and the FDA is going to take emergency action on this and review all the data before they make their decision. But it's expected to be approved in early December. And then we are going to embark on the largest mass vaccination campaign the world has ever seen. It's going to dwarf the polio vaccine campaign in the 1950s. And that's just sheerly based on the numbers of population of the world. In the 1950, we had 2.5 billion people. 2020, we have 7.7 billion people. And so in order to get out of this thing, which I think we all want, and I certainly want to get out of it, we're going to need to get the population vaccinated to a degree of 60 to 70%, and that can achieve herd immunity. Okay, so I truly believe we are closer to the end than the beginning of this pandemic, but it's going to be a little bit longer, and then people are going to have to want to get the vaccine and trust the vaccine. When the scientists say it's safe and the FDA says it's safe, I'm going to say it's safe, and I'm going to get a vaccine when I'm available and eligible to get one. Regarding the kids, you may have questions on vaccinating the kids. Right now, they're doing studies currently on down to age 12, so 12 to 18. So the kids are not going to get the vaccine in the beginning. They may next year sometime, maybe later in the year, but the focus is going to be on over 18 population. Obviously, the virus is not affecting the kids as much. It does affect them, but not as much as the elderly. So, and then the other thing I wanted to say on the vaccine is it is going to be that both Pfizer and Moderna vaccines are a 2-shot series. So you will get one vaccine, and then you'll get a second dose 21 days later or 28 days later with the Moderna vaccine. And the projections for immunity for you are basically 30 days after first dose. So right after you get that first dose, you're still going to need your second dose, and you're building your antibodies, your immunity. So, and also with treatments, one more thing I wanted to mention, they've come a long way from where we were back in March and April. They are not putting people on ventilators unless they absolutely have to. They have got antivirals that have been approved and steroid injections that they can give, and then also increased oxygen. That's kind of the treatment mechanism, and then they're seeing some very good success with that. So the mortality rate has dropped from where we were back in March and April. Unfortunately, the cases are increasing. It's a very contagious disease, 14-day incubation period, which is why we do the quarantining. But we're going to be in it for a little while longer. But as I said, I think we can see some light on the horizon, and I'm going to stay positive. So I appreciate all of you. I'm willing to work with all of you. I've worked very closely with Justin. He's been a good partner. And you can't say that health and business are always working on the same page. And Justin and I have worked really close since this thing started. So I appreciate everything he's doing over there and all of you. And I'm happy to take any questions if I can answer them. If I can't, I will try to look for the answer for you. Thank you.
Super. Thank you, Larry. We absolutely appreciate the partnership with you. Gary, if you want to unmute yourself too for any questions, hit *6 on your phone. I do have one, but I want to open up the floor right now. Anybody on the call have a question for Larry or Gary? Hit *6 on your phone and feel free to ask your question. Anyone have any questions? Okay, I'm going to jump in then. The number one thing that I have heard from businesses locally, and Larry, you shared some great information here a week or two ago, is, what do I do if an employee is sick? What if they test positive? What do we do about quarantines? What if the worker was next to them, all that? What should be the protocol or procedure for these employers to follow with their workers?
Well, that's a great question, Justin, and I did share out that document with you. So the focus is on the guidelines provided by the CDC, which is the close contact for the quarantine. So we are sticking very closely to that, less than 6 feet apart from the person for greater than 15 minutes or more. And that's cumulative 15 minutes over a 24-hour period. So if you're buying for 5 and then 2 hours later you're buying for another 7 minutes, and then later that evening at 5 o'clock you're buying for another 5, it's cumulative exposure because you're repeating your exposure. So focus on that guideline. Now, if they do not meet that guideline for a close contact, they do not have to quarantine. Okay, they do not. So you gotta. That's why it's so important for the businesses to set up these protocols to, as much as they can, keep people socially distanced from each other, and they will have a less of a risk of starting to lose employees. Now, sometimes it's hard because, like in a fast food place, you got people they're close together. When in doubt, call the health department. We have got, our whole team has been repurposed to COVID response, and I've got individuals at least 2 deep on every issue, every item that can come up with these things, so we can assist. Unfortunately, we are not getting to everybody on the case investigations right now, just because of how swamped we are. We are getting some temporary help in here. We've got a temp agency, so hopefully we can to start to catch up on some of these cases. But a lot of it is the employer just going to have to follow those guidelines right now. And I provided that document that gives them some basis.
Thank you, Larry. Gary, anything you want to add to that?
Nope, I think Larry did a great job covering that.
Excellent. And I want to thank Gary too. Larry, I've been sharing your information, obviously, with our stakeholders. Gary, you're sending out information to me. I'm passing that along from the governor's office as well. Anybody have any questions for Gary or Larry? Go ahead and unmute yourself, *6 on your phone, please. Anyone have any questions?
Hey, good morning. This is Shiawassee. How are you, Larry?
Hi, Shelly. I'm doing great today.
Thinking of you often. I know your job turned into something much different than what it was. Thanks for all that you are doing.
Thanks.
I just had a question. Of the 18 hospitalized, 4 in ICU, can you give any more information of ages and underlying health conditions? I'm just kind of curious in our community what the hospitalizations are looking like.
Yeah, that's a good question, Shelly. I know we've talked about it by email. The hospital isn't releasing specific data. What I can tell you, just from the knowledge that I have of our cases, and we always have to be careful of HIPAA, but we have had one in the hospital there that was in their 40s, so they're not just all elderly. We have seen some others that came in to the hospital temporarily, but younger than 40. We had one in their 30s and one in their 20s that required some hospitalization, but recovered and got out. They don't seem to be getting as sick. Obviously, the majority of the cases that get hospitalized, you could safely say, have underlying conditions or have other health challenges. On the website I shared with you, and I'll send that to you too, Justin. There's a state website tracking all this data. It has statewide level data on the numbers of hospitalizations and their ages, and they do have right now currently in the state of Michigan 19 pediatric COVID positive patients statewide. So not a huge number, but boy, if your kid is hospitalized and for whatever reason and they have COVID, that's a stress, when you have the young ones getting sick. So I don't want to minimize it for the risk to the young because it is still there, but the vast majority is the elderly.
Thank you.
Thanks,
Good job
Shelley.
last night on your meeting, Shelley. I listened in.
Oh, thank you. Yeah, it's challenging, no doubt.
It sure is.
Any other questions for Larry or Gary? Anybody have anything?
Can we
Just,
anticipate?
oh, did I hear somebody?
Sorry, it's Shelley still. Probably this question might be more to Gary. Are we anticipating more extension on the 3 weeks, and are we looking at possibly adding more businesses to that? Obviously, I'm on the school board, but I'm also a small business owner in the community, trying to figure out kind of where we might be heading.
Yeah, great question. At the moment, there's no updates as far as like any extension. The reason we're taking this pause right now is we've been here before, as a state. Obviously we flattened this curve. We beat COVID-19 in the state, and then you saw during that time, like in the spring when we had the first initial orders, there was a slow but thoughtful, re-engagement, of the economy. And it was basically because Michiganders all throughout the state, we all banded together and just, did what we needed to do in order to, start re-engaging and reopen our economy. And so we're in not a full stay home, obviously, posture. Nobody wants to go back to that, but just this, pause is what we're referring to. It's a pause to save lives. And, we'll keep everyone updated. That's why I wanted to make sure that, I was on this call, and thanks again, Justin, for making the connection. But I'll keep everyone updated. But right now, as long as we do, what we need to do in this period, we're not anticipating, anything further. But I'll keep everyone updated.
Thank you, Gary.
Thanks, Gary. And what we'll do, I will make sure in follow-up messages, we'll put Gary, your contact information on the email, and Larry as well. But just so our listeners know, Gary and Larry, can you please give them your best contact information in case they have follow-up questions for either of you?
Go ahead, Gary. You go first.
All right, sure thing. So best way to reach me is actually by cell phone. So that number is 517-282-3193. And I'll repeat it again, 517-282-3193. And then the next best place is by email, and it's jonesg9@michigan.gov. So Jones, spelled Jones, the letter G like Gary, and the number 9 at michigan.gov.
Okay, and my contact information, which a lot of you probably already have, but I'll give you the office line, 989-743-2318. Once again, 989-743-2318. My email address is ljohnson, as in Larry Johnson, ljohnson, at Shiawassee, CHD, County Health Department, word, ShiawasseeCHD.net. And I check my phone and my email basically 24/7.
All right. Well, thank you both. I'm going to put out one last call. Anybody have any questions for Gary or Larry before we move on the agenda? Anyone have any questions? Hit *6 on your phone. Okay. Gary, Larry, thank you so much for your time. We very much appreciate the partnership, the resources, and support you're helping provide here in Shiawassee County. You're both very welcome to participate in any future weekly call, Tuesdays at 9. If you have any updates at all. In the meantime, I will continue to share via email the information that I get from Larry and Gary. So you're updated at the county level as well as the state level. So thank you both for being on today. You're welcome to stay, or you can drop off. I do have a few more items I want to cover on different programs and resources. So, but thank you both for for joining today.
Thanks a lot.
Okay. Thanks, guys.
Thank you, Justin.
Yep. Okay. Well, once again, for those that have participated before, in addition to having speakers on, we do like to provide some information on different tools and programs and resources that are current that might be of benefit to some or all of you. So just wanted to hit a few highlights right now. And if you have questions on any of these, obviously, please feel free to get a hold of us. We'll be happy to help. One of the new programs that we're really excited about that I think is going to and already is having a significant impact on our local economy is a new business called Market Wagon. It is basically an online Amazon of local food business. So it's a way for local food producers. It could be farmers market businesses. It could be restaurants. It could be bakeries. It could be beverage places. Really anybody that makes some kind of a food or beverage product have the opportunity to use the e-commerce platform and delivery system of Market Wagon to be able to get to customers not only locally in Shiawassee County, but also within a 10-county central Michigan region. This business is actually headquartered in Indianapolis, but they have set up a hub in Vernon, actually, at the Great Lakes Family of Companies site. Many of you know that right there on M71. They're operating a distribution hub out of there. So I mention it to all of you today for two reasons. Number one, if there are any food vendors on the call, any food makers, producers, we would definitely encourage you to get on there and sell your product. It's another way to increase your customer base, which is a huge factor right now, particularly for our restaurants trying to survive during this challenging time. You can actually make food, prepackaged meals, sell them on there, and generate some revenue. But also, we would highly encourage any of you who are buyers to get on there and take a look at what we have to offer. I think there's 18 or 19 vendors on there now. It's growing weekly. And I think it's just a great way to spend your money locally. Everyone's got to eat, obviously. And it's a chance for you to get your money into the local economy, support our food vendors. So something to consider going forward. We'll probably get a speaker on from Market Wagon at some point in the future as well. Jody, anything you want to add to that? Jody's been working with Market Wagon too. You're a customer, actually. Anything you want to add?
I am a customer. Actually, first I'll just say I've actually talked to our rep. I spoke with him early in the week, or actually late last week, and confirmed that there are some categories other than just food. They have a handmaids and crafts category and a soap and cosmetics category as well. We discussed some things like homemade candles, homemade jewelry. So there are opportunities for people who don't do food and beverages to actually sell their products as well. So you can get on their website and take a look at the different categories. Actually, Justin sent them out yesterday, I believe, right, Justin? So you can take a look at all of those and see what other options are available. But if it will fit in there, they are willing to deliver it. So it does not have to just be food and beverage. But I have actually ordered from them twice. I have been very impressed with how organized they are. You get a text telling when your product has been put on a truck for delivery. You find out exactly what order you are if you're number 1 of 7 deliveries. So they're very organized. You put your totes out the next week and they exchange them. The food has been excellent. There are very clear instructions if you order something that needs to be warmed up. So I've been very impressed. I think it's a great opportunity for people who have a product to offer, but I live in an area where you can't get deliveries, and this is somewhere that will deliver to me. So it's a great opportunity for people who live in a rural area.
Thank you, Jody. Those of you that follow me on social media know I'm really pushing very hard right now for eating local, buying local, shopping local. This is obviously an extremely challenging time for everyone. and we need to try to do what we can to keep our money in the community and try to support some of these small businesses. So that's why we're spending a lot of time on this, trying to get the word out there. So if you have any questions, definitely let us know. We do recognize, despite all the challenges of the pandemic, one of the major issues continues to be finding access to talent. Many of you are still hiring, have expressed to us, boy, we're having a hard time finding people. It's a big issue. It was a big issue before the pandemic started. It's really been exacerbated, I think, since. So we have really continued our efforts as an organization to try to identify resources, programs that can help our businesses with talent attraction, talent retention, talent development. But one of the things I want to mention, you should have seen an email on this a few weeks ago. We put together a sort of a one-sheeter, a talent attraction resources guide that kind of outlines what our organization can do to help you promote openings. Our workforce providers like Michigan Works, education providers like our friends at the RESD, our K-12 systems, also some media and marketing tools as well. So we want to continue to promote that. We're still talking to a number of you, as I said, about trying to hire. It's a great resource tool to help you with trying to get people. So if anyone would like to have a conversation on what those resources are to help you find talent, we'd love to talk to you about that. There are also a number of things happening right now on the training side. So once again, you've seen some of this information by email. There is an open grant program right now, the Going Pro Fund. That's a statewide program. Some of you have applied in the past, gotten dollars in the past, $27 million competitive grant. We're working with our friends at Michigan Works on filling out the paperwork for that. I believe that window is closing here very soon, but it's up to $1,500 per employee for training. So that's an excellent one. Another one that we also sent some information out on is an apprenticeship program. Tony, do you want to touch on that real quick?
Sure. I participated in a webinar that kind of explained how the apprenticeships work. And basically, Michigan Works has somebody assigned to apprenticeships in every region of the state. Here in Shiawassee County, it's Wanda Bigelow. And if you're interested in an apprenticeship, they will work with you to create something that's customized for your specific business that will meet your needs and help you find people that you can train so you have long-term employees who are trained when they come in. So there's a lot of opportunity for making that apprenticeship something that will meet your specific needs. You just have to reach out to Wanda Bigelow at Michigan Works in this area to come up with a plan for that.
Very good. Thanks, Jody. Another item we want to touch on real quick on talent, childcare. This issue is becoming a hugely critical item, particularly in light of all of our schools being virtual. I know several of you have encountered this challenge in your businesses with folks that may not be able to work because they don't have access to childcare. Everyone is stretched thin right now. We really know that's a big challenge. So we as an organization are trying to identify ways to increase the availability and affordability of childcare. And we're actually working on a community assessment right now, try to gain a better understanding of what those specific needs are. Basically quantify what the need is, what the demand is, what the hours of operation are. For example, we have several companies that operate on a 24/7, 3-shift basis, but we don't necessarily have 24-hour childcare. So trying to address things like that. So we're making some good progress, but I wanted to let you know after Thanksgiving, we're going to be promoting pretty heavily an online survey. And I know everyone is surveyed out, but we really need your input as a business and a community organization leader to fill that out and to get that information to your employees, because I believe if we can get more child care facilities online, we really have a really big need out there, and that would serve a big population in our area. So be on the lookout for that. And if you'd like to know more about what we're doing as it relates to child care, please let us know. A couple of state items that are on the docket, and I'm not going to call on him. I think our friend Tyler DeBray-Bender is probably on the call from MEDC. We do appreciate their partnership. We did have a webinar with their trade person last week as it relates to international sales. There is some grant money available right now for anyone that is either doing exporting or would like to get into international sales. The program is called STEP, State Trade Export Promotion. If you're interested in learning more about that, please let us know. I did send out some information via email today about some additional international resources. So given this a very uncertain time, it's a good time, if you're interested, to look for new customers in other countries. And there's a lot of great resources available at the state and federal level to be able to make that happen. Another thing we sent out information on, it's actually another grant program that just came out, and I'm just learning about it myself, but it's for certifications required to win contracts. So you might have saw this last week. It's in partnership with Pure Michigan Business Connect. Really, it can be for not only international, but for example, some of you, our industrial folks, need ISO certifications and other certifications to do work with certain sectors. That is eligible to be funded through this program. So another grant, it's very focused once again on that certification process, but it is grant money out there to potentially pursue. So if you'd like to know more about that, check out that email I sent and let us know. And then the last thing I'll mention on our state friends, actually PMBC again, I'm going to send out via email later today. There is a webinar on December 3rd, so that'll be next week after Thanksgiving. It will be on how to do business with the state of Michigan. So if you've got interest in selling your product or service to state government, that will be a way to learn more about how to do that. So look for information on that. You know, once again, you know, during these challenging times, trying to find new customers, diversification is critical. So we want to make sure we bring those resources to the table for you. And really, that's it today. A lot of information. I do want to put out a call. If you have additional speakers or information you would like to hear on our upcoming weekly calls, please let me know. We definitely want to re-engage with our state and federal representatives. So our intent would be to bring our state rep and state senator back on at some point, Ben Frederick and Tom Barrett, as well as our Congressman John Molinar and Senators Peters and Stabenow to give you Lansing and Washington updates. So that'll be a target for us. But if you have any other folks that you want to hear from, information you want, please let me know. The last thing I'll mention, we are monitoring the federal funding situations as well. Particularly, I know one that it was a top area of focus for many of our folks was the PPP. Many of you went through that. We ended up getting over $60 million into Shiawassee County as a result. Almost 600 organizations received those dollars. We are monitoring whether or not there's going to be more money available, possibly a second bite at the apple for those businesses that are still struggling, maybe get a second shot at PPP. So we're on top of all that. We're paying attention to all that, and we'll definitely be in touch. So with that, it's 9:46. So we've taken up a bunch of your time today. I thank you all for being here. Does anybody have any questions for me while we're still here? Hit *6 on your phone. Okay, well, thank you everyone for being here today. You know, it's unfortunate we had to reconstitute the call, but as you know, we're here to help as best we can. So we're going to continue to provide information to you going forward, and anything you need in the meantime, feel free to get a hold of us, give me a call or shoot me an email. We'll be happy to help. Thanks everyone. Have a great Tuesday.
Thanks, Justin. Thanks, Larry and Gary. Thanks.
Thank you.